today is about drugs in special population. A special population means pregnancy, pediatric age group, geriatric age group, renal failure, hepatic failure. Just one thing, the last day we were discussing about dose of spironolactone, it is 225, okay, not 2.5. বুঝলি তুই ছিলিস, বুঝলি তুইও তো ছিলিস, 25. আচ্ছা, so let's start with pregnancy, drug used in pregnancy. So what is teratogenicity? Anyone? কানে গেছে এই কথাটা কোনোদিন? হ্যাঁ, so she is somewhat right. So drug that has teratose means monster. Okay, teratogen means to produce a monster. So the drugs that can produce malformation in fetus. In ADR we have discussed about thalidomide. Thalidomide producing phecomelia. So there are drugs that can cause this malformation. Now up to 3 weeks, 0 to 3 weeks, drugs can lead to abortion. Okay, from 3 to 8 weeks, in 8 weeks of pregnancy, drug causes malformation of organs. From 8 weeks onward up to gestation, drug may cause some musculoskeletal problem. Now the health of mother is related, the health of fetus is related to health of mother. If mother is suffering from hypoxia, suppose there is asthma or there is convulsion, so if mother is suffering from hypoxia, the baby in her womb will be suffering from hypoxia. Okay, so there are certain drugs that can produce adverse effect. So how? So one is that drug can directly act on fetus. For a drug to act on fetus, the drug must cause the placenta. There is something known as placental barrier. পড়েছিস তো অ্যানাটমিতে। What's your name? সাক্ষী। আগে কোনোদিন দেখিনি। That's what I am telling. I have never seen you. Your name? অর্পিতা। আগে কোনোদিন এসেছিলি? না। তোর নাম? আগে কোনোদিন এসেছিলি? কবে এসেছিলি? আচ্ছা, আর ছেলেদেরও প্রচুর নতুন মুখ দেখছি। তুই আগে এসেছিলি? হ্যাঁ, তুই আগে একদিন এসেছিলি। তুই এসেছিলি? মনে পড়ছে না। এরা দুজন আছে, ঠিক আছে। ফর দ্যাট drug must cross the placental barrier. Okay, so which drug can cross the placental barrier? The drugs that are larger in size finds it difficult to cross to the placental barrier. ঠিক আছে। The drugs that are more lipid soluble easily cross into the placental barrier. The drugs that are protein bound remains in the plasma of the mother. They don't cross the placental barrier. If you have two drugs, one is bounded to albumin, suppose, and other is mostly free, then the free drug will cross the placental barrier. The bound drug will remain bound to the albumin or whatever protein, whatever binding agent it may be there. So, how is this the mechanism that causes the teratogenicity? One is the folate metabolism, drug that cause abnormalities of folate metabolism. They causes the deficiency. They can cause teratogenicity by disrupting the neural plate formation. Neural plate, what is neural plate? For your knowledge of anatomy, neural tube. এই এমব্রায়োলজি তো পড়ানো হয়েছে। হ্যাঁ হ্যাঁ ঠিক আছে, জানলেই হলো, তোর জানলেই হলো। Then neural crest formation, from the neural tube cells migrate to different part of the body for organ formation, that may be disrupted. Then there may be oxidative stress. Okay, the drugs like phenytoin, valproic acid, antiarrhythmic drugs, they all causes oxidative stress. Then there may be abnormality of blood supply. There are drugs like ergotamine. This causes vascular spasm. The blood vessel supplying the placenta, they causes vascular spasm in blood vessel supplying the placenta. Okay, that may hamper the growth of baby. There may be certain specific drug acting on certain specific enzyme like ACE inhibitors. Have you heard this name? না, ACE inhibitor. হ্যাঁ বল, জোরে বল, সব ক্লাস শুনুক। So ACE inhibitors. Now these ACE inhibitor may cross into the placenta and they may cause agenesis of kidney or the malformation of kidney. Okay. Then there are certain hormones. During ADR we have discussed this diethyl silvestrol. কি করে? Hey, well, diethyl silvestrol causes adenocarcinoma in the progeny. If mother is taking diethyl silvestrol, it may cause adenocarcinoma in the girl child, female child. Okay, certain hormones may be harmful. So from this chapter, teratogenicity comes as a short note. Get it prepared. ঠিক আছে? So what are the drugs that could be applied safely in case of pregnant women? In pregnancy there are certain changes that take place in the body. The body retains water. There is increase in cardiac output. There is stasis of GI tract. So anything that is administered orally, it may have trouble in absorption. Fat may increase, body fat increases. So there may be alter in distribution. GFR increases. So there may be faster elimination, ঠিক আছে, body water the relative concentration of albumin decreases because the total amount of albumin remains the same because body retains water, so the concentration of albumin may change, so the binding of the drug to albumin may change, ঠিক আছে. So what drug can be applied safely in case of pregnancy? Now there is an USFDA classification, ঠিক আছে. ক্লাসিফিকেশন কি? USFDA classification A, B, C, D, X. Now USFDA classifies the drugs that are in group A as safe in pregnancy, like thyroxine, multivitamins. These are safe to be given in pregnancy. Drug B, no, now before a drug is developed, it is applied to animals, rat, mice, whatever be it, guinea pig. So drugs that are there in group B, those are not found to cause any abnormality in animals. No human experiment has taken place, so data is absent. Okay, so these are considered safe. Drug B, like paracetamol, okay, amoxicillin, these are safe. Drug C has shown abnormality in animals. When tested in animals, they have shown abnormalities. Human data is absent. However, the benefit of using such drug outweighs the risk, so they are given taking the risk, ঠিক আছে. রিফাম্পিসিন comes in this category. শুনেছিস রিফাম্পিসিন কিসে ইউজ করে? টিউবারকুলোসিস, ঠিক আছে. Drug D are drugs that causes anomaly in humans, but the benefit outweighs the risk, like phenytoin. Okay, phenytoin কিসে ইউজ করে? হ্যাঁ, এপিলেপসি, ঠিক আছে. না, thalidomide is a tragic drug, like phenytoin. Now to control epilepsy is very hard to control an epilepsy, ঠিক আছে. If mother is epileptic and having fits, it will definitely cause adverse effect on the fetus, so it is better to control that epilepsy, even knowing that there may be problem. Usually supplementary dose of folic acid is given to the mother to prevent this neural tube defect. Okay, so even knowing that there will be risk, drug is being given. X, so having the drugs that have proven to be having adverse effect and are not given, like thalidomide, ঠিক আছে. Anti-cancer drug, tretinoin, ঠিক আছে, these are not given. X একদম বন্ধ, ঠিক আছে. So old classification, there is a new classification. New classification is much complex. Drugs given in pregnancy comes as a short note, ঠিক আছে, লেখা যাবে. So get it prepared, ঠিক আছে, write it well, ঠিক আছে. If given, try to give this classification, fetch you good marks. ঠিক আছে, this is what drugs given in pregnancy. Now let's come to baby. So question comes, babies are not miniature adult. মানে anyone? জেনারেল ফার্মাকোলজি তো পড়ানো হয়েছে তো। বেবিজ আর নট মিনিয়েচার অ্যাডাল্ট, ঠিক আছে, মানে অ্যাডাল্টে যেরকমভাবে ড্রাগ দেওয়া যায় বেবিকে সেভাবে দেওয়া যায় না। বেবিজ আর স্পেশাল পপুলেশন। সো দ্য ইন বেবিজ renal function is less than that of full grown adult. Renal দিয়ে কি করে? What is excretion? So excretion is not that of like that of adult. In babies, the liver enzymes are not fully developed. What are the uses of liver enzyme? Metabolism of drug. In babies there are neonatal jaundice. দেখেছিস এখানে Pediatrics এ often babies have jaundice because the fetal hemoglobin breaks down, that iron is released and cannot be metabolized by the bilirubin, cannot be metabolized by the body, by the liver, because the enzymes are not that well formed. ঠিক আছে, in babies the blood brain barrier is not well formed. Neonatal jaundice, if the bilirubin level are high, it may get deposited in the brain because the blood brain barrier is not well formed. In babies the proportion of water is much higher in the body, 78 to probably 78 to 80%. What is the proportion of water in adult? 60. ঠিক আছে, so there is proportion of water of the babies are high. The babies also have lesser fat compared to that of adult. So what will be affect? It will affect the distribution of drug. ঠিক আছে, babies the GI tract, the pH of the GI tract is not akin to that of adult. It may be pH may be higher. The movement of bowel are slow. So oral distribution, oral absorption may be hampered. বারবার বমি করে দেখেছিস babies, small babies. Peristalsis may not be that well developed. The surface area to body weight is much more in case of babies. Okay, so babies are not miniature adult. Question আসে, question prepare, get it prepared, পরীক্ষার সময় যেন ঠিকঠাক আনসার পাই। And what about the absorption? The skin of the babies are highly vascularized, so absorption from skin is more. In case of intramuscular injection, the movement of the babies are low, so unless you make movement, the blood circulation become low, so intramuscular absorption may be slow. And parectal absorption is good for the babies. Now how to calculate the dose of babies for children? Children, the classification: 0 to 1 month হচ্ছে ইনফ্যান্ট, ঠিক আছে, 1 month to 1 year, না সরি 0 to 1 month হচ্ছে নিওনেট, নিওনেট, 1 month to 1 year হচ্ছে ইনফ্যান্ট, ঠিক আছে, 1 year to 12 year হচ্ছে চাইল্ড, 12 year to 18 অ্যাডোলেসেন্ট, ঠিক আছে। Now how to calculate dose in case of children? We have discussed that babies are not miniature adult, so you can't give dose of that of adult. There is a Young's formula. Young's formula uses age, ঠিক আছে, চাইল্ড ডোজ হচ্ছে ডোজ ইন অ্যাডাল্ট ইন্টু এজ ইন ইয়ার্স, ঠিক আছে, ডিভাইডেড বাই এজ ইন ইয়ার্স প্লাস 12, বুঝলি? অনুষ্কা কোথায় হারিয়ে গেছে? লস্ট, হ্যাঁ, ঠিক আছে। So let's calculate. Let the adult dose be 100 mg adult dose, ঠিক আছে। এজ অফ চাইল্ড হচ্ছে 36 month. So calculate the dose. Age dose in adult into age in years divided by age in years plus 12. আচ্ছা, তাহলে ও বলছে 20 milligram. So here the age is given in months. So first thing you do about mathematical calculation, be careful about the units, ঠিক আছে। 36 month is 3 years, তাহলে কি 100 into 3 divided by 3 plus 12 কত আসছে? ওই যা আসছে, ঠিক আছে। Then there is another formula. Clark's formula using body weight, ঠিক আছে। The same dose in adult divided by weight in kg divided by 70, ঠিক আছে। So let's do some mathematical calculation. A baby weighing say 10 kg, ঠিক আছে। Dose in adult 140 mg. Calculate the dose of children 20. দেখা যাক, ডোজ ইন অ্যাডাল্ট হচ্ছে 140 ইন্টু ওয়েট ইন কেজি, কত কেজি? 10 কেজি ডিভাইডেড বাই 70, যা আসবে তাই, ঠিক আছে। ক্যালকুলেশন পারা যাবে, ঠিক আছে। Another calculation uses the surface area of the body. So in that case, dose in adult into surface area in meter square divided by 1.7. Some write 1.73 and some write 1.76. For simplicity, you take 1.7. ঠিক আছে? So let's do some calculation. Dose in adult will be 100. Surface area of baby is 0.34 meter square. So calculate the dose. আচ্ছা করা যাক। ডোজ ইন অ্যাডাল্ট হচ্ছে 100 ইন্টু 0.34 ডিভাইডেড বাই 1.7, so 0.2 into 100, 20. ঠিক আছে? So let's come to the second part. So the formulation is present in syrup. হ্যাঁ বল। চাইল্ডকে দেওয়ার জন্যই তো বার করছি। হ্যাঁ সবই দেওয়া যাবে, ঠিক আছে, অ্যাজ পার মানে ক্যালকুলেশন করে যেরকম আসবে দিবি। হ্যাঁ ঠিক আছে। লেটস ক্যালকুলেট সামথিং। লেটস দ্যাট medicine is present is a syrup. Syrup contain 5 mg in 1 ml. তাহলে কত ml দিতে হবে? Concentration of syrup is 5 mg in 1 ml. So how many ml of syrup will you give? 4 ml. কনফিউজ হয়ে রয়েছে এখন, শেখ কি বলছে? তাহলে এরকম ভেবা চেকা খেয়ে রয়েছিস কেন? সেনগুপ্ত বোঝা গেছে? So 20 divided by 5, 4 ml. Sorry, 4 ml. বোঝা গেল? অঙ্ক আসে, ঠিক আছে। One thing you better be clear, that be careful about the units. Now let's come to geriatric patient. Geriatric means old age, ঠিক আছে, old age patient. So old age patient consists of numerous comorbidities. Comorbidities means sugar, pressure, thyroid, COPD, asthma, ঠিক আছে, number of such comorbidities. Suffers from multiple disease, হাঁটু ব্যথা, কোমর ব্যথা, ঠিক আছে, পার্কিনসনিজম, dementia. So old age patient also have some socioeconomic challenges. Caregiver, the patient may be bedridden, he may not be able to take his own medicine. Caregiver may be absent, he may not have financial ability to buy medications. There may be dementia, he may forget to take his medicines. Multiple medicines are being taken, multiple diseases, multiple medicines are being taken. So there are chances of drug interaction. Okay. So in old age, renal function gradually decreases, liver function decreases, cognitive ability decreases. So problems. So there may, so before giving medication in old age, must take care of all these factors, must consider all these factors, that these are the factors that are challenging factors, so they have to be dealt with. ঠিক আছে? So what happens in old age? Renal function decreases. There may patient may suffer from renal failure. The classification of renal failure, stages of renal failure, anyone? No. No. According to GFR. Anyone? GFR greater than 90, stage 1. ঠিক আছে? 90 to 60, stage 2. 60 to 30, stage 3. 30 to 15, stage 4. Below 15, stage 5. এই ক্লাসিফিকেশনটা দেখিসনি কোনোদিন? So what do you mean by GFR? So what does it measure? What is the significance of GFR? So it gives an idea about function of kidney. The lower it is, the worse it is. ঠিক আছে? What are the substances used to calculate GFR? Inulin. Inulin is the classical substance that is used to measure GFR. শুনেছিস? সবাই শুনেছে তো, ফিজিওলজিতে পড়ে এসছি তো। সে করতে পারে, কিন্তু দ্যাট ইজ বিং ইউজড ফর measuring of GFR, the classical substance used for measuring of GFR. ঠিক আছে? For that is, for in the classical experiment, inulin was used. In practical use, creatinine is used to measure GFR. শুনেছিস? Creatinine. So there is something known as Cockcroft-Gault formula. What is it? 140 minus age in year into clearance, ঠিক আছে? into weight in kg divided by 72 into 18 kg, 72 into creatine, serum creatine concentration in milligram per dl. পড়েছিস তো? দেখেছিস তো ফর্মুলাটা? ঠিক আছে? So here you can measure the serum creatinine concentration in milligram per dl, and using this formula we can calculate what is the clearance. অসুবিধা হচ্ছে? 140 minus age in years. If you can't, 140 age in years. বল, কিছু বলছে অনন্যা, কিছু বলতে চাইছে। ঠিক আছে? That is how you calculate the clearance. So what do you mean by clearance? What do you mean by clearance? This is the formula. This is how calculation is being done. এই clearance মানে কি? না, ঠিকঠাক হলো না, তবে কাছাকাছি গেছে। ঠিক আছে, বল। amount of plasma কিংবা amount of blood that is clear of a substance in unit time, that is clearance. Clearance কিন্তু short note আসে, ঠিক আছে, prepare clearance as a short note, so that is clearance. So let's suppose there is a person with renal failure. ঠিক আছে, so what will happen? His kidney is not working. So what is the function of kidney in pharmacology? Of course, we are dealing excretion of drugs. So if the drug accumulate in the body, what will happen? Toxicity, adverse drug reaction will start to appear. However safe the drug may be, adverse drug reaction will start to appear. So what is the way forward? We must go for dose modification, right? So that drugs does not accumulate in the body. What is steady state concentration? সব চুপচাপ বসে রয়েছে, এটি বল, শুনেছিস কোনোদিন, কানে শুনেছিস? এনিওয়ান? আচ্ছা, so let this be time versus concentration graph. Okay, initially when it is given, the concentration rise, then it starts to fall. Here again drug is applied, it again rise, then tends to fall. Here again it goes on, and then it becomes something known as steady state concentration. So you can see that the concentration is within a range. Yes, we try to keep the concentration in a range, therapeutic concentration, where the adverse effect will be minimal and the drug will act. So you can see this is the steady state concentration. So what's peculiar about steady state concentration? The amount of drug that is being excreted is equal to amount of drug that is being administered. ঠিক আছে, যতটা ঢুকছে ততটা বেরোচ্ছে, ঠিক আছে, তাহলে কতটা বেরোচ্ছে, how much drug is being excreted? So clearance is the amount of fluid that is made free of a substance or drug, whatever be, ঠিক আছে, into concentration of drug, ঠিক আছে, that is being excreted per unit time. And what is the drug that is being administered? Let it be D, dose, divided by dosing interval. Here it is unit time, so by that calculation it is divided by dosing interval. ঠিক আছে, 500 gram administered after every 8 hour, 500 divided by 8. বোঝা গেছে এটা? Now suppose the patient is having renal failure. So in that case also we need to make the amount of, after reaching steady state concentration, we have to keep the plasma concentration in steady state concentration. His kidney is malfunctioning, so he cannot be administered regular dosage. So let concentration of drug is D by T into clearance. ঠিক আছে? So this D by T has to be same, DT, drug concentration in steady state as in renal failure patient as well as in normal patient. That's what I want to maintain. বিদীপ্তা বুঝতে পারছিস? কনফিউজ লাগছে পুরো। তাহলে কি করা যায়? D normal T normal into clearance normal is equal to D renal T renal into clearance renal. বোঝা গেল? ভাবলো বসে রয়েছে। আশি বুঝেছিস? একবার না বললো, একবার হ্যাঁ বললো, তারপর কি বললো কিছু বোঝা গেল না। আমরা বুঝেছিস? ঠিক আছে। So dose, if you think that dosing interval is going to be kept same, ঠিক আছে, D normal clearance normal is equal to D renal clearance renal, clearance by Cockcroft-Gault formula. ঠিক আছে? So whatever with the clearance D renal you can find out. বুঝলি? So that's how you make a change in dose. You can also alter with the timing interval, whichever is convenient to the patient. ঠিক আছে? That's how you control the dosage in case of renal failure patient. Now there are certain assumptions. Assumption number 1, that serum creatinine is the adequate reflection of the renal function. ঠিক আছে? I am taking that sorry, serum creatinine level reflect the condition of the kidney. Number 2, the pharmacokinetics and pharmacodynamics remains the same. In a renal failure patient, you see the acidity of GI tract starts to increase. Okay, there is uremia. What do you mean by uremia? Huh? Increase of urea in the body. ঠিক আছে? So there may be increase in gastric acidity. So absorption may be hampered. ঠিক আছে? Then then distribution. So there is excess fluid in the body that may affect the distribution of the drug. ঠিক আছে? Then metabolism, the liver function may not be adequate. Some drugs are also metabolized in kidney. ঠিক আছে? So that may not be adequate. and excretion, of course, kidney is non-functional. So what happens in the body, there is a compensatory mechanism. When one thing fails, the other start to compensate it. So the assumption is that compensatory mechanism does not offset the what is being calculated. Okay, that is the assumption. বুঝলি? ঠিক আছে। আর কি? Hepatic failure caused by most common alcohol consumption. Cirrhosis এর পেশেন্ট দেখেছিস? এই cirrhosis এর পেশেন্ট হয় না? লিভার সিরোসিস কমন পেশেন্ট, পেট ফুলে আসে। So alcoholic is the most common cause of liver failure, ঠিক আছে? Cirrhosis, in cirrhosis there is the protein synthesis by the liver is hampered, drug metabolism which is done by the liver that gets hampered, ঠিক আছে? There may be esophageal varices, সেটা কি? Portal hypertension, that may be there, ঠিক আছে? For our purpose, the protein that is hampered, there may be fluid accumulation in the body, so that distribution are changed. Drug metabolism gets hampered. So hepatotoxic drug, name some hepatotoxic drug. The antitubercular drug, they are hepatotoxic. Isoniazid, rifampicin, these are all hepatotoxic drug. Okay, they get you must, in case of liver failure, you must administer them with caution. Some nephrotoxic drug, বল, prostaglandin cox inhibitor, these are nephrotoxic drug, ঠিক আছে? আচ্ছা, আর there are certain drugs that are excreted in breast milk, like lithium. So if the mother is breastfeeding, you must be careful.